Just an FYI for you, a warning, there is going to be some gory stuff. I'm talking about my body and some fun things that are, and not so many fun things that are happening to it. So if you don't like talking about bodily stuff, you probably shouldn't watch this. But yeah. Alright, hi guys, it's Sunny. I know that the last couple videos that I've been doing haven't been as usual, if there even is such an as usual for me, but that is because I've been going through some health issues. I just wanted to quick say something about that. If you do follow me on Facebook or are friends with me there, you might have seen a health update short little video I did. Yeah, I'll put a link down below if you want to watch that. But basically, I have a cyst inside of my ovary, not even on it. As far as I know of, it's not cancerous or anything crazy like that, but it has been causing a lot of pain for me and uncomfortability. I haven't been able to work for like a month now because I have a very strenuous job and I can barely sit without pain, so you know, throwing boxes might not be the best decision for me to do right now. So I haven't been able to do that, and I've been off work and trying not to let the depression and loneliness swallow me whole. I've been playing a lot of Sims and watching a lot of movies and just trying to keep a positive attitude. Basically, the timeline of what happened here is last year I did actually have a cyst that was not officially confirmed, but it was around like April of 2020. I had woken up randomly with like this very big feeling of fullness or bloating. The best way I've been able to describe it is it feels like there's this big like water balloon or balloon inside of me, like right around here, right around my left pelvic bone. And if I sat, I could feel it. I felt like it was gonna pop. And it was a really weird feeling, but I was kind of like, okay, maybe I'm just like really bloated, because it came out of nowhere. I didn't really get a chance to do anything about it, and we were in the middle of COVID, so no one wanted to go anywhere. So no one really went anywhere to do things unless it was a complete emergency. So when it popped, I was spotting and I felt very shaky, very lightheaded, like I felt like spacey almost. I didn't really know what was going on. I was really cold. I don't know if I had a fever or not, but I remember us just like sitting there not knowing what to do, whether I should go to urgent care, and I kind of wanted to, but at the same time I was being told that I shouldn't because of COVID. So I ended up just staying there with my boyfriend because I was over with him at the time, and I was watching Troy with him for the first time. And I don't remember half of that movie, I'm not gonna lie. Not because it's really long, just because I was so zoned out. It was like disassociation at its finest. So that's how that went. And then I obviously, by the time that I got an ultrasound and went to go see my gynecologist, we didn't really have the ability to see that it was there because it wasn't there anymore. It had popped. So there was no confirmation that that's what it was. Then fast forward to about like 2 months ago, I guess at this point, I started feeling that like fill feeling again in my lower left side, same spot. I didn't just like wake up with it this time. It was like more of a gradual thing. I can kind of feel it. And I am very attentive on my body and like things that are happening with it a lot of the time. So I know immediately when something doesn't feel the same as it normally does. And I had also had problems with it before, so I kind of just wanted to make sure I took action immediately. And I got into a gynecologist, and I was like, you know, kind of in pain and kind of not. It was kind of on and off. Some nights, especially on my long weekends, I would feel it a lot more. There was like one weekend or one day or something that like it was really, really, really bad. It was right before I had to go to the doctor, and I couldn't sit because I was in that much pain. Like it hurt to sit and it hurt to like stand straight, and that's why I'm like leaning back and forth because it still doesn't feel right. I was scared that I was gonna pop it. I didn't know what was going on at the time. Nothing had been confirmed, and then I had my doctor's appointment the next day. She did get me in for an ultrasound, and it was confirmed that I had a cyst inside of my ovary that was making my ovary about 2 to 3 times bigger than the other one, which the other one was completely fine. So yeah, it wasn't the most fun feeling or realization. But the one thing that I did feel when I read that was just like complete validation, because for once I could finally know that I wasn't just imagining this, I wasn't overreacting, like there was something wrong. And I feel like for a lot of people that go through like feminine problems like that, you don't know when it's normal or not because we always go through so much pain every single month just through periods. You never know when something's serious. So I'm always worried I'm overreacting. I don't know, maybe that's just me. Obviously, we had to go along and do something. They wanted to wait because normally cysts do resolve themselves, they'll like go away. Because you actually do get cysts every single month. They're just not normally a problem. They're normally smaller and they kind of just go away on their own. You barely feel them if you do at all. But because it was so big, they did want to check it in about, I think it was 3 weeks. I also had an infection from that first time, probably from the cyst, or the other way around. I really don't know what caused it still. Sometimes they just happen. Sometimes they're from ovulation and things get like messed up if you have hormonal imbalance or stress or literally anything, so that's fun. It's like, hey, this thing happened that caused you a lot of pain, but there's not really a cause for it that we know of, so you just gotta deal with it. Try not to stress too much. Me? You want me to not stress too much? Okay. But it did cause an infection, which was a lot of the pain that I apparently had at that time. I got on meds. That was resolved in like a week, and I felt so much better for like 2 weeks. And then the weekend before my appointment was another long weekend, and oh my god, I was in so much pain. It really hit me, and that's when I was like, I need to know what's going on. There is something wrong here. I know I have a cyst. I know it could pop at any moment. I know it could cause torsion at any moment, which if you don't know what torsion is, it's when your ovary has that heavy thing on it and decides to just flip upside down, which can cut off circulation of blood flow and cause internal bleeding, or just to go dead, and a lot of other fun things that can cause you death in like a short amount of time, or just a lot of pain. So I've been trying to watch out for that this whole time, and then I'm also going through pain, also trying to work, and then my last night on a long weekend before the next couple free days and then back to work, I started spotting. I don't know why. I still to this day don't know whether that was a period or if that was like spotting from stress on my ovary. Yeah, I started spotting and then it got really bad, and then like there was no like major bleeding, but it definitely was like what I normally get from my period since I've been on birth control, which is never really heavy. I bled for 2 weeks. 2 weeks. I kind of think that it was partially my period coming in on like a random time period because my, my entire feminine area is fucked up right now because of the cyst. But then also like probably spotting from the stress on my ovary. So it's just a fun little mix. I ended up almost going home the one night, and that's when my boss kind of told me like, hey, he basically said that if I'm in this much pain the next night that I come in, he's sending me home for my own good, because I'm not very good at saying that I'm in pain. So I was basically just standing there like this, just going, oh, good. I went in, I talked to my doctor. She was also very confused as to why it was causing me so much pain. She actually moved up my ultrasound appointment to that day. She also did a blood test to make sure I wasn't having some sort of ectopic pregnancy. Also, just a fun thing, while I was in for my ultrasound, the lady said my ovaries are very high up. So that's fun. Long story short, it grew a lot bigger. The measurements were like 3, 4, and 5 centimeters. The first time I got the ultrasound, and this one, it was 4, 5, and 6 centimeters roughly. So it grew a lot for 3 weeks of time, not even. And it also became a hemorrhagic cyst with a retracting clot, and it was now in the danger zone, which is between 5 centimeters and 8 centimeters, which is when they start worrying about it, like doing stuff, like fucking me up and like flipping over and that shit. I know that was a lot of information. Basically, it just meant in my cyst, there was a small spot, for mine specifically, it might be different for yours, but there was a small spot of blood. It was bleeding. I don't know exactly how or how that works. If you want to go explain that in the comments, you can. Especially if you're a doctor or a gynecologist or anything like that, and you know what that means and you can put it in layman's terms even better. I would love that. But basically, she just said that there was blood in it, it was bleeding. It might have been why I was bleeding and spotting for 2 weeks long, but it had grown, and she said that surgery was probably the best option. As to why I'm doing this video this week, right now is because I have surgery this Friday in 2 days. Probably when this video is going to be going up, actually, if I can get it up in time. I also just wanted to kind of post a video about what's going on with me, so if anyone else is dealing with this, because I know that there is a lot of people that deal with this. Even when I was just looking online for like answers to my own questions, I saw hundreds of other women going through the same problems. So I thought it best I at least put my information and my personal experience up. Basically with the surgery, they are going to be removing the cyst, and they're possibly going to be removing my ovary and my tube as well on that side. My doctor did say though that because I'm so young, they're going to try not to take my ovary. But honestly, at this point, I think it's like a 50% chance just because it's so big. And it's been 3 weeks since then, so who knows if it grows? Oh, don't like thinking about that, but there's a big possibility. But it's going to be a laparoscopic surgery, which basically means they're going to be going in from the belly button and from like around here or around here, which means I'm going to lose my belly button piercing because it's only been in for about 3 or 4 months and it's not fully healed, and I can't wear it in and I can't wear it after because infection. So that's gonna be sad. It's what it is for health reasons. I just want to say quick as well, I will be posting a video afterwards basically saying how the surgery went and any aftercare stuff. She did say it would take like 1 to 2 days to heal, which I highly doubt. Nothing against her. I've seen different answers from different people, and also I feel like if you take out my ovary, it's gonna be a little bit more of time. But they did give me a week off just because I think my job has been causing a lot of the pain to be like way worse, because like the week after like a week of being off work, I felt 10 times better just because I was resting and I wasn't moving around doing shit, I think aggravating it. So I will definitely suggest that if you are in like a position where you do a lot of heavy lifting or a lot of really active stuff and you're dealing with this, find a way to take it easy. But yeah, that's basically what's been going on with me. Some symptoms, if you guys want to know them. I'm not a doctor. I don't know if any of these are specifically for that, or maybe I'm just depressed. I don't know. But I have had a major loss of appetite. Like, I've been eating a good amount, but I don't crave many things. I try to avoid foods that make me bloated because that is very painful. Sitting like on hard surfaces for long periods of time definitely hurts. So I normally try to get like a cushion or blanket to sit on. I've been sitting on the couch a lot or laying on the couch. Beyond that, I've also been really tired, really shaky. I think my iron has been a little bit problematic. I don't know if that's because I'm like dehydrated more or if it's just because I went from like crazy exercise activities to like nothing. Who knows? But I've been very dizzy, loss of appetite, and very nauseous sometimes. Not throwing up, that's good, but definitely nauseous. So that's fun. I get cramping, I get back pain. It kind of feels like I have a belt from the front to the back. It just kind of feels like a clamp there, like pinching. But yeah, that's basically what I've been going through lately. I should be fine, but I've been very scared. I'm not gonna lie. This is definitely not a fun thing to go through. I'm glad that I finally know what's going on, but it is pretty scary. I'm 20 years old now, and I was not expecting for my ovary to just say F you on my birthday. So yeah, if you guys have any questions for me or you want me to do any like kind of videos on this stuff, I definitely will. Just leave it in the comments and give it a big thumbs up so I, you know, can get attention on this, so more and more people can see this, because I kind of want to just help as many people with this as I can. That is about it for today. I hope you guys did enjoy this video, and I will see you guys later. Bye.